know someone who has chronic pain, right? Chronic pain affects a lot of people. It doesn't work. 8 out of 10 Americans will experience significant low back pain in their life, and that's a huge amount. 50% of American adults experience chronic pain, and this could be from headaches, back pain, knee pain, shoulder pain. It can be from fibromyalgia. There are all sorts of causes of chronic pain, and a lot of people suffer from it. Now the thing is, you can see the top 10 causes of disability. Arthritis and rheumatism is at the very top. Back problems and spine problems right below that. And now the rest of the other 8, all of those can have pain symptoms as well. So really the top 10 causes of disability all involve pain in some degree, even though the very top 2 are musculoskeletal pain significantly.
Mental, emotional problems are up there too, guys. That counts as pain.
Yeah, there's a lot of different types of pain. Now the thing is, pain serves a very good function. Although it is uncomfortable, it is useful. Now pain can seem like this when you first see it, but when you understand it, it becomes more like that. So what is pain? Pain is just a message from the body that something is wrong. It always comes, it's made in the brain to say that there's some threat, perceived danger that's happening in the body that you need to be aware of. And once you understand that threat and what that danger is, whether real or not, then you can address the issue. And so we're going to get started with, so the idea is, do you shoot the messenger or do you find the root cause? And the analogy is, if you are in your home and the smoke detector goes off, what do? Do you rip the batteries out and just say, to heck with you? Sometimes when it's 3 in the morning. But you also look for a fire, right? And if there's a fire, then you know what to do. Now the body's the same way. It's telling you signals, but what we're taught to do is just turn off the signal. Just rip the batteries out and pretend like nothing happened. Now if you went to the mechanic, because the check engine light was on, you gave it to them, and they took it back and sent it back to you 5 minutes later and said, okay, I fixed the problem. You said, oh, that's great. What'd you do? Like, oh, we took the light bulb out. We turned off the check engine light. You'd say, that doesn't make any sense. What's wrong with it? Like, well, you came in because the check engine light was wrong. That's the problem. We just fixed it. That wouldn't make any sense to you, would it? Does it make sense for your car? It should make sense for your body. And so what we're going to do is discuss what these messages could mean and what to do about the pain that you feel, because the idea is, with the understanding of how to use these tools, when we give you the tools that can help, it'll make more sense. And then you'll know how to use them properly. So Dr. Jack is going to go over, here are some of the main causes of pain. Inflammation is the major one. Chronic inflammation causes around 80% of chronic diseases. And so, pain is one of the symptoms of inflammation. It could be acute or chronic. Structural stress or damage. Just like your car, if it's out of alignment, it's going to cause issues. Same thing with your body. If it's out of alignment, it will cause problems. Unprocessed emotions or traumas. This is one that a lot of times we don't give enough credence. The brain is always going to make pain signals, and that can come in the form of memories and emotions. A negative mindset is called catastrophizing. I'm not a really big fan of that term, but the idea is your mind actually plays a major role in your pain. They've done studies. They know that how you process the pain and how you look at pain in the terms of your life will actually change how you rate the pain and how much you experience. Poor lifestyle, we'll get towards this at the end. That poor lifestyle, definitely, it's one of the root causes of the pain. Your level of exercise and your diet. And we've talked about this at past POW meetings when we talk about sugar especially. And if there's an underlying disease process, things like cardiovascular disease, gout, diabetes, all these can lead to pain as well. So to figure out how to get rid of pain, first we need to find the root cause. So how do we go about doing that?
Yay, the 3 A's. Okay, so how do we treat the cause? This is a really easy tool Dr. Kelly came up with. I love it. It's really simple to remember. First is awareness, obviously. How can you fix a problem if you're not aware of it, right? Second is analyzing it, understanding your pain and understanding your body. Why are the pain signals there? When do they happen? Things like that. Then action. What can you do to actually acknowledge and treat or prevent future pain, current pain and future pain? So we're going to look at awareness first. How are you able to, mechanic, right? You go, the check engine light's on. Well, is it doing anything weird? It makes this weird clicking sound when I do, go over bumps. Well, you're communicating to your mechanic what's happening in the car so they have a better idea of how to go about looking at it, how to test it, how to treat it, how to fix it, what parts it needs. How are we supposed to, as doctors or the mechanics, be able to do that for you if you don't even understand your pain? Okay, so being really aware of what causes the pain. When does the pain happen? Are there specific triggering events? Oh, well, when I sit still for 3 hours straight at my desk and don't get up. Okay, well, that's, very indicative of specific types of pain and very easy for us to help you address if we know that. It hurts when I eat these foods, okay? It feels better when I do X, Y, or Z. Taking anti-inflammatories lets me know that if that helps you, it's probably an inflammation-based pain, right? So it hurts when I wake up in the morning. Okay, you're probably sleeping wrong. Do you need a new mattress or a pillow? Things like that. So the more aware you are of your pain and its nature, and the more you track it and are aware of it, the better you can communicate that to us and the better we can help you get out of pain. Okay, it just makes sense, right? So instead of suppressing or avoiding or, it's just I'm getting old or, what a plethora of reasons we convince ourselves that pain exists, really tapping into and turning the volume of the stress down, of the suppressive thoughts of let's just ignore it, down enough so that the pain can speak to you in a way, it's going to tell you everything you need to know. And then once you know, you can let us know, and then we can fix it. So I think after you're aware, it's really empowering, actually, right, to be aware of your own body. Then you can understand if treatments are working. Okay, well, this physical adjustment or this food or this supplement, these all worked up until this point. Okay, well, what changed at that point, right? It's kind of just being your own friend in a sense, listening to yourself the way you might listen to another, being compassionate to yourself the way you might be compassionate to another. That's the only way that we're going to make progress as your physician and you for your life, So these are really the things to start thinking about when we're talking in terms of awareness. Awareness is the number one thing we need to be able to help you so you can help yourself. All right, so analysis. Identifying the root cause. So once we're aware, again, you need to go to a professional, chiropractor, right? How many of you have seen or do see a chiropractor? Anybody? Is it helping?
Yeah.
Kind of, sort of, yeah? Okay. So chiropractic is a great tool for a toolbox. But just like a hammer can't screw in a screw, right? A chiropractor is not going to be able to treat root causes of inflammation. If your body's inflamed or in pain and something falls out, a bone or something like that, and you need an adjustment, right? Or you have the same body mechanics every day, sitting at your desk, doing the same motions, lifting here and putting on this shelf, right? How well is the chiropractor really going to be able to undo that? If you need a screwdriver and you're using a hammer, are you really going to get well? Is it causative change? So analyzing yourself, not just depending on, hey, you kind of do this thing and it hurts here, so you can fix that. Rather than I'm analyzing my lifestyle, realizing I don't get up and move my body enough, realizing I'm doing the same physical body patterns consistently, so maybe I need to undo them or do their counter movement, in order to help analyze my situation and fix myself, right? And then the chiropractor is kind of the cherry on the sundae, just like us. Eventually, we get to the place where patients don't need to see us as regularly anymore. You know why? Because they're doing the awareness and analyzation and action piece themselves. They've come to us for guidance and help, but eventually they get to this place where they can do that in their own life, make their own connections, remove their own obstacles to cure, and apply their own new skill sets. So let's see here. Now Dr. Kelly is going to talk about action.
So once you know what's happening, then you can make a concerted action step. And it's important that when you have an action and when someone says do X or do Y, that you understand why you're doing that, because then you can use it more effectively. And that's one of the issues that sometimes happens when people come to see us, is that the doctor told me to do this, or the doctor says I have that, but they don't know what it really means. And because of that, they aren't empowered to actually live healthier. And then how can you expect to get any better if you're making the same decisions? And so we urge you to always ask questions and understand why you're doing stuff. So some good treatments for pain. Physical medicine, chiropractic would fall under this. It's any sort of hands-on modality. So you could be putting bones back into place, moving muscles and soft tissue around, relaxing things. There's all sorts of hands-on modality that falls under physical medicine. Anyone hear of ART, active release technique? That's one.
So painful, but so worth it.
Yeah, it's like massage on steroids,
Yeah.
pretty much.
Very active, yeah. They're getting into the tendon and ligaments and really releasing old, trapped, long-standing chronic patterns in the muscle movement.
Yeah, I got it on my tendonitis a couple times, and after 2 sessions, it was gone. Our chiropractor actually provides it if you're interested. Really good, but there's all sorts of modalities like that in the physical medicine arena that can help with pain. Again, if you don't address the root cause, it's only going to be very short-term or mid-term. It's not going to be a long-term solution. Acupuncture and traditional Chinese medicine. Somehow, they discovered thousands of years ago that by sticking little needles into people in specific spots, it could do things like eliminate pain. And this is one thing I did once I woke up and my shoulder was absolutely throbbing, and I don't know why, but it was enough to wake me up. And so I got my acupuncture needles, and I surrounded the area with about 5 needles, and not 10 minutes after I finished putting them in, the pain was gone, to the point where I started feeling my elbow, and I realized that I had also had elbow pain, but the shoulder pain was so loud and strong that I hadn't even noticed it. But either way, I was able to sleep after I took the needles out. I was able to sleep after that. It is unbelievable getting rid of pain, and it's been around for a lot. Anyone use acupuncture before? A couple people.
What do you think about it?
Oh, I love it. It didn't work for me. You want to get pregnant?
I'm excited. Okay. How many times have you tried?
I think I went to her about 6 times.
Okay.
Give it a shot.
Didn't work.
Yeah.
Didn't work.
No one thing is ever going to work 100%, and the good news is that there are a lot of tools out there. But yeah, it works a good amount of the time, but not always.
Yeah, I think the thing is just, not giving up. No stone unturned. There are certain things that have never worked for me, medications especially, they make everything worse for me. And when I looked at using acupuncture and things like that, that tended to work. Some soft tissue or chiropractic things don't work. The crack and crunch actually can make my system worse versus it really alleviating serious pain for others. So there's never really one size fits all. And that's really the goal of naturopathic medicine, right? Is we have this whole toolbox. Which tool do you need and best fits for you? And maybe it's a couple of those working together. So if acupuncture didn't work, definitely stick with it and keep trying stuff to see what works if you're still suffering, definitely.
Yeah, and sometimes we can tell even by questioning whether something is not right for someone, if they're not a good candidate for that treatment. But acupuncture, what it does is it uses, basically your body has these pathways, they call meridians. You can think of it like a subway network, and you have different stations, and those stations are the acupuncture points. And each point has a specific thing that it does when the needle is inserted into that area. And much like if you didn't get power to your house, the toaster wouldn't work and the oven wouldn't work. If you don't get qi or energy to your organs, they won't work either. And that's the Chinese medicine philosophy. Now, by using the needles, and if you don't like needles, you use cups as well that can help, and also herbs. These all affect the meridians that can help balance the body. That's really the main purpose.
And even just acupressure, applying pressure to the area of needles. I have a patient who's severely afraid of needles, but we do acupressure and get just as great results. And it's amazing to see her walk in under certain conditions and walk out almost a completely different person. So, and again, it's not one size fits all, but for certain people it definitely works. So next.
There's a few supplements that have been really the craze when it comes to pain. Turmeric, who's heard of turmeric? Yeah, turmeric and curcumin. This is one of the new, this is like the new NSAID, they're calling it, because it's really good at decreasing inflammation. It's also anti-tumor, and it has a lot of health benefits. Now, this is straight from the Arthritis Foundation. 75, they had a certain curcumin, which is the active ingredient, the extract. It provided long-term improvement in pain and function in 100 patients with knee osteoarthritis. And as we saw, the osteoarthritis was at the top of disability. And this one herb, this little root, could do such a great improvement in their pain. They also have reduced joint pain and swelling in patients with active RA, better than diclofenac. Diclofenac is like an Advil. It's an NSAID. So even better than that pharmaceutical, turmeric is acting. Now you want to be careful. You got to get the right one. It's active in a fatty acid substance. That's what kind of keeps it and delivers it into the body. And you also want to make sure that the quality is good and the dosage is high enough. And that depends on what type of extract you get, what the dosage is. But anyone hear about the study they did on the Walmart and Target supplements? Basically, they tested several supplements and found that most of the time there is absolutely not what they're saying it is, either the wrong dosage or something completely different.
82% of the time.
Yeah.
So I don't know if you guys were here for that Lunch and Learn where we talked about quality versus price and how sometimes you have to shell out a little bit more just to make sure that it's actually what it says on the label, because they're not held to any kind of standard. Those, when you go to a GNC or a Vitamin Shop or a Walmart, and not to throw those places under the bus, they offer good things. Sometimes it's a manufacturer error too, but when they totally blindly did not pay attention to brand or anything, but just randomly pulled things off the shelf and did a concentration test, 82% fell significantly, and I'm not talking a couple milligrams short, significantly short, or were completely devoid of the product that they were marketing. So just so you know, when we say things work and you say, well, I went, to Target or Walmart and I bought it off the shelf and took it for a month and I didn't notice anything, chances are you're probably a victim of circumstance because of that. So when you come to a qualified physician or a licensed professional who has access to the quality, the physician strength quality supplements that we know for sure are quality tested, research and development departments of all of these supplement companies know exactly what's going in, where it's sourced, how it's processed, it's not heat damage, things like that. That's really the difference. And we see it all the time. People come in with like a suitcase full of supplements, but it doesn't work. Well, let's get rid of everything and put you on these 3 or 4 that are targeted for you that I know are high quality. And 4, 6, 8 weeks later, my life has totally changed. I'm a different person. And it really just had to do with A, you're taking too much, B, you're self-treating, and C, it's just not high quality product. It's really not. It's a difference between saying, I eat meat, and you're going through a Burger King drive-thru, or you're eating like grass-fed filet mignon, right? I mean, you guys can understand that quality difference, right? Or Flint, Michigan water versus like the water we have, bottled here. Seriously, that's the difference. It's still water, right? But is it? So when you're dealing with turmeric, those are definitely things to consider. It's also worth noting that cultures that eat diets high in turmeric have the lowest arthritis and inflammation rates in terms of body pain and things like that. So it really does work. It's just we're not culturally exposed to it as much. We don't eat a lot of curries or things like that that have it in our diet, but by taking it in a supplement or slowly adding it to the diet, you will definitely notice decrease in pain.
Yeah, that's a great way to actually just proactively help your body, is just include it in the diet. There's one supplement that they tested that was ginseng, I think, and
Yeah.
it said it was ginseng on the bottle, but it was just dried onion powder, and they tested it. It was like, what's even close to ginseng?
Crazy, right?
Fish oil. You probably heard of fish oil. This, some people are starting to recommend fish oil supplements instead of baby aspirin to help with cardiovascular disease because it has a similar effect. It's very anti-inflammatory. It also thins the blood, but it does it a little bit differently. Whereas aspirin, it will bind to platelets and it holds on to them until they die and doesn't let them work. Fish oil actually helps feed the pathways that will either modulate be pro-inflammatory or anti-inflammatory, and it's more on the anti-inflammatory side. And so it helps your body make the right soup of biochemicals that will keep inflammation at bay, rather than just attacking these platelets and keeping them from doing something that may be important, which is why if you're ever going to get surgery, they tell you to stop taking aspirin 2 weeks before, because that's a time when you need to clot up and heal, and aspirin won't let you. And so fish oils are a much healthier way of having a similar anti-inflammatory effect, but without crushing a pathway that is needed.
Yeah, it's also like driving a car with no oil, right? I mean, how sticky does that get and overheated and clingy? So by having sufficient oil in the machine, lubricating joints, building things that are based on fatty acids, neurons and things in the brain for connectivity, that's why it helps with depression and other things like that.
Yeah, so EPA and DHA, those are your two omega-3s, and it helps, it's been studied for RA, lots of other inflammatory conditions, and one study showed that it decreased joint tenderness and stiffness in RA patients and reduced or eliminated their NSAID use. NSAIDs, again, your Aleve, Motrin, ibuprofen, etc.
I know the same for krill oil.
Yeah,
Yeah,
krill is
question.
great.
Krill oil is, it's a little bit different in its, what's in it. It has more vitamin A, for example, but very similar idea, a lot of omega-3s, very anti-inflammatory. May not be as good, the high vitamin A may not be as good for someone who has like liver issues.
Or is pregnant or may become pregnant.
Exactly.
Vitamin A has been shown to cause deformities in fetuses, so you definitely want to look out, especially if you're taking a multivitamin or eating a lot of like beta-carotene containing foods, because that eventually turns into vitamin A. So again, it's stuff like that where you want to really talk to a doctor. Quick little email. They'll be able to point you in the right direction. But I think you're not at risk of being pregnant, right? Okay. So next we're going to talk Prolo.
Prolotherapy, so this is a fairly new treatment. It's actually not that new. It's been used since it was actually started to begin in the 20s and then started to catch on in the 50s. So it's been around for a long time. But now with sports medicine being as important and profitable as athletes get paid more and more, and as our baby boomers start to get older and want to feel young still, prolotherapy has really exploded in popularity. Prolotherapy is similar, you can think of similar to a cortisone shot in the way it's delivered and the way that it feels, but it has completely different effects. Cortisone is just shutting off inflammation, but it actually leads to a weakening of connective tissue in the area. The structures actually get weaker. Prolotherapy is the exact opposite. It creates a little bit of inflammation because inflammation is actually good for the body. And what happens is that creates healing. Inflammation calls platelets and growth factors to the area, and then that actually leads to an increase in strength in the ligaments, in the tendons, and even helps regenerate cartilage, especially used for joints. And so this is a huge movement in the anti-aging field of medicine, and it's used for, a lot of it's used for low back pain, knee pain, even shoulder pain. It has other uses, but those are really the main uses. And the best part about it is that while it is a little more aggressive than just putting turmeric in your diet or some acupuncture, it is still, if the root cause is the structures are loose or weak, and it's a structural issue, it can actually help rebuild the joint. And it also helps to reset the nerves as well so that they're not, sometimes the message is being sent, but it's like you still have to turn off the alarm sometimes, and this can help also turn off the alarm while fixing the problem. So
It's
this-
really great to see
Yeah.
people walk in with like years of chronic pain, and yeah, it's uncomfortable sometimes. You know, it's obviously injections into a joint, right? Especially a painful joint. But walking back in and being able to like walk upright after being hunched, or being able to have range of motion again and like actually lift things that they couldn't before, it's pretty incredible. So really quickly, I do want to speak to Dr. Kelly said inflammation is a good thing, and then we just said inflammation is a cause of pain. So what I want to talk about just for a brief second is the therapeutic window, okay? Too much or not enough of a good thing. We all know it, right? 1 or 2 drinks, you're good. 10 or 12 drinks, you're probably throwing up and praying to the porcelain god. So you really want to have, it's just like anything else, right? Inflammation, there is a perfect little window. Not enough because we're shutting off those centers with like steroids and NSAIDs and things like that. You get disconnected from the body, okay? Things are happening and damage is being done when you're not aware of it because you can't feel it. The messages are not coming through. Too much, where the volume is turned too high, okay, and you can't function in your daily life. You have headaches, mood disorders, body pain. Things are just degrading and not they're not generating fast enough to keep your quality of life normalized, right? So right in this middle ground, okay, a little bit of stress from working out, stress from being happy and excited. Just like inflammation, a little bit keeps the body alive. It keeps the messages flowing. It keeps healing factors being laid down, and it keeps the damaged tissue or cells or whatever being cleaned away, okay? So it's that sweet spot of just enough to keep you going, but not too much to be causing a disease process. Does that make sense to everybody? So what's happening in joints a lot of times, and why Prolo helps so much, is it's not targeted. It's called diffuse inflammation. Okay, so the whole thing is just inflamed and in pain, and the body is confused. By targeting with a long needle, getting specifically into the capsule where the damage or the pain is, we're stimulating very targeted inflammation. Okay, so little alarm bells are going off at very specific spots in the body where the pain is happening, where the ligament or the muscle is being damaged. And the body can send cleaning cells, right, to kind of vacuum up all the old mess, and then constructing, like construction workers, right? When your house is hit by a hurricane kind of thing, you need somebody to clean out the debris first, and then everything can rebuild from the floor up. That's exactly what prolotherapy does targeted. Okay, so if you have a little bit of that diffuse inflammation all over your back, your head, your foot, this stuff hurts, and I can't seem to, my motivation is low, my mood is unstable, I kind of get stomach aches here and there. Those are all signs of diffuse inflammation. Okay, a little bit everywhere. So that's when turmeric, fish oils, we need to clean up everywhere, right? Where damage to a specific joint because of a sports injury, a motor vehicle accident, things like that, that's where Prolo helps because it's very specific and targeted. So does that kind of make more sense with the inflammation thing? Okay, cool. I just wanted to make sure.
Yeah, it's this acute inflammation is like the construction crew coming and cleaning up, but you don't want them living there afterwards.
Yeah.
That would be chronic inflammation when they never leave. The inflammation has to end, otherwise it causes problems.
Healthy lifestyle habits. Okay, so I'll take over from here. So diet rich in whole foods, right? Antioxidants. We've talked about this before in the whole cup analogy. Not to beat a dead horse, but basically we're all born with a cup. Some people it's the size of like a thimble, others it's a big gulp. Okay, so just keep that in mind. And everything in between, all sizes. So things happen to fill our cup up, okay? Lifestyle choices, eating sugar, a high stress life, traumas, caffeine, alcohol, smoking, cigarettes, pollution, environmental toxins, all these things kind of fill our cup up. Now when our cup runneth over, okay, that's when disease happens. And that's why the thimble people sneeze and their back goes out. Oh, I'm so full, right? It's so quick for them to, I walk into a room with perfume and I have a sneezing attack, okay? They have a very small tolerance for their cup fills up very quickly. Where then you have the big gulps. Well, I smoked a pack of cigarettes and ate a red meat steak every day for 90 years, and now I'm getting cancer, or now I'm having signs of pain. They had the ability for a higher toxic load, And again, there's everything in between. You know, like a coffee mug is pretty average and standard for most people. So as we fill that cup up, what are we doing to empty it out? What kind of stress modulating behaviors are we doing? What kind of antioxidants are we eating in our diet to help address the oxidative stress or the stuff that's filling up that cup? Are we drinking water? Are we getting enough sleep? Are we taking in things and putting things on our body and in environments that help us heal and empty that cup out? So what we want to do is as we fill it, empty it, okay? And that creates balance. But what we notice a lot of times is people don't maintain balance. Their cup runneth over, and they're not sure why. And again, that takes us back to the 3 A's, right? First, be aware that your cup is running over. And secondly, learn how to analyze what makes your cup full so that you can take action to empty the cup out. So these are some really basic things to help empty that cup, okay? And help prevent, release, treat, and prevent further pain. Okay, so again, diet, number 1. Sleep, 8 hours. Who actually gets 8 hours of sleep in here? Yay! 2 or 3 people? Sleep is awesome, you guys. That's like, what did I do? I read a meme the other day that said, you know, when your computer is messing up, and it's like, well, did you try to unplug everything, turn it off, and turn it back on? And it usually works great after you do that. That's what sleep is, guys. You need to hit your reset. You need to unplug everything and turn it off so that you can wake up and turn it back on and function better. Sleep is when healing happens. That's when we can psychologically, our dreams help process all of this, the things that we've soaked in throughout the day, all the problems and issues. Our body has a chance to actually rest. We're no longer like this, so it's not causing the pain or the strain, right? We're relaxed, so it can go address the issue. Again, construction workers clean it all up and start rebuilding stuff. So without good sleep, you're definitely going to experience increased pain over time, chronic increased pain.
Yeah, less than 6 hours actually leads to inflammation of the nerves and brain.
And 30% weight increase. So those of you struggling with your weight, consider looking at sleep. Are you sleeping enough? Does your body have enough time to reset and address the problems that it's experiencing during our waking life? The body movements. Move your body, guys. Even if you have to set an alarm. It's like, well, I have this deadline, I have to work. I fall victim to it too all the time, right? But without moving our bodies, blood flow, lymph flow, oxygen, all these things that are going to help clear out, empty our cup, aren't going to happen, okay? We need to move our body. Even if it's just touching your toes for 2 minutes every hour, it's better than nothing. Processing emotional stressors. This one is a hard one. A lot of people want to be convinced that this doesn't take an impact or they can deal with it or it doesn't affect them. It's just biology, guys. This isn't like you're a weak person for crying or, you know, you're aggressive because you're angry. We're human beings. We have a limbic system. Deal with it, okay? We got to accept it. Emotions are real. Emotions trigger things in our body that are damaging. Cortisol, stress hormone, epinephrine, norepinephrine, adrenaline. Our heart races. Okay? Damage is occurring under those stressful situations. So I personally, as a physician and a person, see that the people who process their emotions are actually much stronger and healthier. Okay? It's the people and the false belief that you're not strong if you don't process, you know, if you just suppress. You're stronger if you avoid. That's really not true. You're just making yourself sick. And I can't feel that stuff for you, right? I can help you coax it out, but ultimately you guys have to do that work, and your body's going to thank you. You're going to have less signs of anxiety and depression. You're going to have less pain in the body, less emotional pain and physical pain. Okay, so just acknowledge the biology. Okay, I got to work out, I got to cry, I got to journal, I got to talk to a friend or family or loved one. I have to get pissed and throw things, whatever. You're human. It's not going to last forever, okay? So the last thing is cultivating positive and hopeful attitudes. This is huge. What you think is what you are, just as much as what you eat is what you are. Biologically, what we eat, that's what our body builds and how we create new cells. What we think is how we act, is what we do, is what we get back, okay? So if you're critical of yourself, you're going to be critical of others, you're not going to make a lot of friends, right? People aren't going to want to be around you. You're going to be isolated, which then you're going to convince yourself, well, I'm isolated, nobody likes me, and it's the slippery slope of this hamster wheel, right? Positive thinking is one of the number one things. They had cancer patients list and have a gratitude journal versus cancer patients not, not made to journal at all, okay? This is a really well done study. You're totally supported to look this up because I thought it was incredible. The people who focused on their gratitude daily, okay, had a higher rate of remission and had a better attitude toward treatment and their lifespan. Even people who were terminal. It was just proven. They had less, cytokines? Some sort of inflammatory factors in their blood. They had a better white cell count. I mean, this is biology, guys. This isn't like, banging on a drum and hoping problems go away. Positive thinking actually creates positive biology, which creates positive behaviors and patterns.
We will cover in the meet actually how the mechanisms of how this actually slows aging using an enzyme that they know how it works. It's actually pretty exciting to think of that way.
I'm off my soapbox now. Okay. So the 3 A's, awareness, analysis, and action. Now you're
Awesome.
empowered. What about the
Speaking of
meet? Yeah.
So we will cover all of these things that we discussed and more in depth at the men's empowerment session. Now this is going to have, each week the first week we're going to do kind of an intro to basic wellness and what the program's going to be like, and give you some measurables to actually go through so you can monitor your own health. Each week we'll go over a disease, we'll go over an issue that causes it, like either stress or inflammation. And then we'll talk about solutions on how to do it, and that will always incorporate a lifestyle thing that you can do for free on your own to actually get healthier. And we'll discuss things like oxidation and how even positive thinking and your mental attitude can decrease oxidation and also decrease aging. Week 2, we have cardiovascular disease, stress, and stress reduction. We'll talk about how stress affects the body and what you can do about it. We're going to give you specific tools. Week 3, we're going to do diabetes and nutrition and also obesity and how to eat in a way that will help keep your hormone levels in check so that you can keep your weight in check. Week 4, we do pain, inflammation, and exercise. And one of the issues is if you're in pain, how do you exercise? And so we address that. How do you exercise? What type of exercise can give you the most benefit for the least amount of input? And then week 5, we do a lot of aging, brain health, men's health, oxidation. Now the good thing about it is that on top of lecture, you will get activities that you can do to assess where you stand with that issue and with that lifestyle. And then handouts and supportive, we'll actually go over some exercises you can do to actually put it into practice. So it goes beyond just a lecture. It's not going to be a standard lunch and learn. There will be education portion, but then a lot of it is going to be you actually discovering where you fit and what you can do to be healthier. And a program like this, really, it would cost you, with doctor visits, seminars, classes, etc., thousands of dollars, and the company has offered to pay for it for you. And so I encourage you to at least come to the first week and see what it's about. If nothing else, you try, but at least give it the first week, see what we're going to do, and you'll be setting goals, and then we can take it from there.
It's really cool.
Invite your spouse or your
Ladies,
Yeah.
spouses,
a
brothers,
father that wants to come, anybody.
boyfriends, sons, anything.
Yeah, it's
Seriously.
really nice of border states to open it up to even the spouses. Again, this is something that could provide a lot of benefits, and you don't have to spend anything other than your time. And the thing with health is that you end up paying for it eventually. You either invest early or you pay for it down the road, and it's usually at that point it's not as fun of a process.
If your
It really
fire
doesn't feel
alarm's
good.
going off, guys, this is a really great way
Wait till the house is burned
to
down.
acknowledge, save the house. And Border States is paying for it. It's really great. He worked really hard, we both did, to make a really comprehensive program for you guys. So again, even just the first one, see what you think, give us feedback. If you guys are resistant to coming, we'd love to know why. Is it the time commitment? Is like an hour to 90 minutes every week for 6 weeks too much? How do you value your health? What would be sufficient for you guys? I mean, it's only 6 weeks, right? And again, like he said, if you really took all the information that he outlined, all of the exercises, the worksheets, the applications, the at-home treatments and things like that, and you went to a physician or another course or seminar, it really would be thousands of dollars. So, I mean, and Border States is awesome. They're doing it for you guys because they care. They really do. This is a health initiative to really make your quality of life as employees. This is so rare and special, so I really hope you utilize it. I really do. And women, please. Spouses, yeah, boyfriends, like sons, anybody that you care about, a male in your life who could benefit from something like this. We look at a lot of, risk factors for disease, okay? A lot of screening. Do you currently show signs of disease? So all of the A's. We're going to help you become aware, help you learn how to analyze, and help you learn how to take action. So this could really help you uncover some serious stuff and in a lot of ways get you toward better health. If you're in pain, if you're suffering something chronically, this is a huge way to go about doing it. And please spread it around. I know guys are tough. I don't need it. It's cool. But it could really be helpful. And it's only 6 weeks. It'll be over before you know it. How fast did the last 6 weeks go by? Since the new year, right? Like in a flash. So the next 6 weeks will go by just as quickly, and you'll be much better off for it. More empowered, more educated, and maybe even like applying things here and there. So anybody who attended the WE, what did you think about it? Just kind of women's perspectives.
Definitely worth it. And you don't have to sign up for each one either.
Yeah.
The entire course. I mean, you sign up for the entire course, but if you can't make every one of them because you have something else going on, don't let that stop you from signing up.
We upload everything on the YouTube
Everything is
channel.
uploaded, you won't have to miss a class.
So if you miss one, listen to it in the car or something. You'll still get all the worksheets, all the intake stuff, all the action take-home stuff. You'll get one-on-one with a doctor if you have questions that you don't have to pay for. I want to reiterate, you don't have to pay for this, guys, and you have a doctor to answer any and all questions you may have. So I really want to drive that point home. Anyhow, anybody have any questions? All right, you're free to go. Thank you.
Thank you for coming.
Thank you.